Hello, my name is Dr. James Shamia. I'm a pulmonary and critical care physician and also Senior Vice President and Chief Operating Officer at the University of Tennessee Medical Center. This is now our third week of sharing with you data related to the COVID-19 situation, particularly from a hospital perspective. I'm going to go through the same format that I've gone in the last 2 weeks, and unfortunately the data continues to worsen. So here you see the number of new cases week over week being diagnosed across all of these counties. You see that there continues to be a significant rise in the right-hand side of the graph in the number of cases. But I also want to point out the amount of testing that we're doing is significantly less than it was back in December and January. So we do feel that there are a lot of undiagnosed cases likely occurring in the community. So this is the slide where we compare case rates from these other southeastern states. And we've told you in the prior weeks that Missouri and Arkansas are 3 to 4 weeks ahead of us. And so you can see that they do appear that they're starting to probably plateau. They're not really coming down, but they're leveling off. On the other hand, with Tennessee and Mississippi, the graph suggests that those are starting to come down, but this is daily reporting. And so we really think this is more of a reporting issue. And so we want to watch this for several more days before we would say these are leveling off. Our expectation, based on everything else we're looking at, is these are still going to go up for a significant period of time. Now moving on to the hospitalizations. This is the graph that shows you the number of people in the hospital each day across all the hospitals across all of these counties. When I first shared data with you, that was 302 patients. Then last week it was 418, and now it has increased to 477. And so that line is still very much headed up. You see that we're very much on pace very soon to break our prior peak, which was at 615 patients in the hospital at one time. This is data from our hospital, and I want to point out a few specific things. First of all, we have today 132 COVID-19 patients in the hospital. That's an increase in 33 from 7 days ago, and an increase in 105 from 30 days ago. 24% of those patients are in the intensive care unit. Then in the lower left, you see the inpatient vaccination status. 81% were not fully vaccinated of those patients in the hospital, 19% fully vaccinated. We have looked at some of the specific information to try to find trends of those who are vaccinated and who are not vaccinated in the hospital. First of all, it's very rare for a vaccinated person to require intensive care, and extremely rare for them to require the ventilator. We've also noted that extreme age correlates with breakthrough admissions, meaning vaccinated patients who are in the hospital. We've also noted that vaccinated patients may be more likely to have uncontrolled diabetes and obesity. We definitely see in the unvaccinated group young, healthy patients in the ICU on the ventilator, and again, these are people who really don't have other medical conditions. To close today, we certainly understand that most people don't even think about healthcare unless they need healthcare, and this makes perfect sense. But we feel like it's our obligation to tell as many people as possible what's happening in the healthcare system right now, so that when people do need to engage the system and need healthcare, they're not surprised. And I think it's safe to say that the healthcare system is strained right now and seems to be becoming more strained with each passing week. The place this is probably most evident is in our community emergency departments, and they're busier than ever. We've made a lot of decisions and adjustments to try to accommodate and adjust to the situation, but all these decisions have implications. So first of all, we have altered and adjusted our non-essential procedure schedule, particularly those patients requiring a bed. And we're now actively managing our procedural schedule every day to determine that tomorrow's procedures can all occur. We are operating surge areas in the hospital, and we are in the process of trying to staff additional areas as our COVID-19 census continues to increase, and we're still very, very full with other patients. We've made a request to the state for external staffing assistance, because we want to supplement our staff any way that we can. And as we shift resources to try to adjust, even outpatient care delivery may be affected. And so the bottom line is that this is ultimately affecting patients throughout the care system, whether they have COVID-19 or if they have some other issue. It's going to ultimately affect all patients. So I know it does get to the point where I sound like a broken record, but I want to reinforce a few things that we've talked about in the past few weeks. So first of all, I've shown you this the last 2 weeks, but the difference between the types of illnesses that go to an urgent care versus what needs to go to an emergency department. I'm not going to go into a lot of detail again, other than simply to say we want those things that truly don't need the emergency department and emergent care to try to access the healthcare delivery system in other ways. And the prior videos go into more detail. But then lastly, we really need everyone's help to get through this in the best way we can and as quickly as possible. And that really just gets back to the 5 core actions. I'm going to spend just a minute on this. First of all, get vaccinated. We know that, as I've already mentioned, has a huge impact on preventing people from getting in the hospital. And even if they do get in the hospital, it's very much preventing people from becoming critically ill. Please keep your distance, and this one's huge. Stay at home if you're sick. We know that society is very active, but this is so important. And then certainly wearing face coverings. So remember, even if you get vaccinated today, you're not immediately protected. And so the more people wearing face coverings, the quicker this will end. And then hand washing and cleaning surfaces. So just a quick reminder, we mentioned this in a prior video, but there is a therapy for outpatients who have COVID-19 for those who qualify. It's called a monoclonal antibody. So if you've been diagnosed with COVID-19, not in the hospital, and wonder if it would benefit you or if you would qualify, please contact your physician, and if it's indicated, the appropriate referral can be made to one of the various sites in town that infuse the antibody. We again thank you for your attention and your interest. We will continue to monitor the situation closely, adjust as we need to, and we'll be back next week to give you another update.